Did you know there is a country where an American retiree can receive full coverage for hospital visits, surgeries, specialist appointments, and prescription drugs for as little as $45 a month? Or that one of the most respected public healthcare systems in the world, rated fourth globally, actively enrolls American expats the moment they receive residency, with consultation fees that run about $10 per visit? How about the fact that one country on this list does not just give you health care, it gives you a legally mandated discount of 20% on hospital services and physician fees just for holding the right residency card? Well, most Americans assume that leaving the country means leaving their health care safety net behind. That fear keeps a lot of people from ever making the move. But here is what almost nobody in the conversation talks about. For United States retirees who have established legal residency abroad, some of the world's most capable healthcare systems are open to them, not as tourists paying full price, but as enrolled participants in national health networks, often for a fraction of what they spend on Medicare and supplements at home. Today, we are breaking down 5 countries that give United States retirees free or subsidized health care, what it costs to enroll, and the one thing about each system that most Americans do not find out until it is too late. Let's start at the bottom of the list. First on the list is Panama. Panama doesn't make this list on the basis of its public healthcare system alone. It makes it because it combines legally mandated discounts with the most affordable, high-quality private care in the Western Hemisphere. Panama City is home to a cluster of private hospitals affiliated with Johns Hopkins University, and medical procedures there routinely cost 50 to 70% less than equivalent care in the United States. A knee replacement that runs $40,000 in Florida can cost closer to $12,000 in Panama City, with comparable surgical outcomes and English-speaking medical teams trained at American and European institutions. But the deeper story for retirees is what the Pensionado program actually unlocks in healthcare terms. Panama's Pensionado visa is open to anyone who can demonstrate $1,000 a month in lifetime pension income, and the average American Social Security recipient already exceeds that. The visa comes with a legally mandated 20% discount on hospital services and physician fees at healthcare facilities throughout the country. That discount is not discretionary. It is written into Panamanian law, and providers are required to honor it every time you present your Pensionado card. Legal residents can also access Panama's public Social Security health network after establishing residency, covering a range of services at minimal cost. Private health insurance for American expats in Panama runs roughly $50 to $125 a month, depending on age and coverage level. For a 65-year-old retiree, a solid private plan covering specialists, hospitalization, and emergency care often runs $100 to $150 a month, a fraction of what an equivalent Medicare supplement costs in the United States, where premiums for seniors commonly run $300 to $500 a month or more. Prescription drug costs are significantly lower in Panama as well. Many common maintenance medications for conditions like hypertension, diabetes, and high cholesterol are available at local pharmacies at a fraction of American retail prices. Panama's life expectancy currently sits at 80 years, ahead of the United States average, reflecting a healthcare system that has been delivering accessible and effective care for decades. The country sitting above Panama on this list takes the public model much further, offering zero premium enrollment once residency is established and a retiree prescription discount that brings medications down to 10 cents on the dollar. Beyond the formal discount system, Panama's location offers another practical advantage for American retirees because direct flights to major United States cities mean that visiting family or receiving specialized care back home does not require navigating complex international connections. Our next country might surprise you: Spain. Spain's national health system, the Sistema Nacional de Salud, is consistently ranked among the strongest in Europe and one of the most effective in the world. Legal residents in Spain pay no monthly premiums to access the public network. There are no copays for general practitioner visits, no fees for emergency care, and no charges for hospital treatment or surgical procedures within the public system. For retirees specifically, the prescription discount is one of the most generous anywhere. Retiree category patients pay just 10% of the cost of covered medications. If your maintenance medications run you $300 a month at an American pharmacy, the equivalent in Spain's public system might cost $30. That number applies to essentially every drug in the national coverage formulary. Spain's average life expectancy of 83 years is among the highest on the planet, a direct reflection of how deeply the country invests in keeping its population healthy across a lifetime. To access the national health system as an American expat, you need to establish legal residency. Most Americans use Spain's non-lucrative visa or the newer digital nomad visa. Once registered with your local municipality and contributing to the Social Security system, or once you reach retirement age with proof of sufficient pension income, enrollment in the public healthcare network follows automatically. The income requirement for Spain's non-lucrative visa currently sits at approximately $2,400 a month for a single applicant. For Americans receiving Social Security plus any pension or investment income, that bar is reachable, but worth verifying carefully against your specific numbers before starting the application. For anyone who can clear the threshold, the package is remarkable. No premium, universal health care, 10% prescription copays for retirees, specialist care at public hospitals, and a Mediterranean lifestyle in one of the world's most beautiful countries. A couple living comfortably in a mid-sized Spanish city like Valencia, Seville, or Malaga spends considerably less than they would in a comparable American city. The country just above Spain on this list is arguably more accessible for Americans on a fixed income, with a lower income requirement and one of the highest physician-to-population ratios in the European Union. Moving up the list, we come to Portugal, and this is where things get genuinely exciting for American retirees on a fixed income. Portugal's public healthcare network, the Serviço Nacional de Saúde, is rated 4th in the world according to the most recent Global Citizen Solutions Retirement Report. It covers general practitioner care, hospital treatment, specialist referrals, preventive screenings, vaccinations, and mental health services. The out-of-pocket costs for enrolled residents are minimal. Consultation fees run between 5 and 15 euros per visit. Prescriptions are subsidized between 15 and 95%, with essential drugs for chronic conditions like heart disease, diabetes, and respiratory illness carrying the highest subsidy rates. Portugal has one of the highest physician-to-population ratios in the European Union, at 5.3 doctors per 1,000 residents. Only 2% of Portuguese residents report unmet medical needs compared to 7% across the European Union as a whole. That gap reflects a system that consistently reaches the people who need it. To access the public network as an American expat, you need to establish legal residency. Most Americans use Portugal's D7 passive income visa, which requires demonstrating around 870 euros a month in stable foreign income, roughly 950 United States dollars at current exchange rates. That is a number many American Social Security recipients can meet without additional income sources. Processing the D7 visa takes a few months, but once approved and registered with your local health center, you are enrolled in the national system. Many American retirees in Portugal also carry a private supplemental insurance plan to reduce wait times for specialists. These plans run between $400 to $1,100 a year, well below what Medicare supplement premiums cost in the United States, where Medigap policies for a 65-year-old can easily run $1,500 to $2,000 a year. Even adding the private supplemental costs to the equation, total annual healthcare spending for most American retirees in Portugal remains a fraction of what they were paying back home. Portugal's cost of living outside of Lisbon is significantly more affordable than most Americans expect. A couple living in Porto, the Algarve coast, or a smaller inland town can live very comfortably on $2,000 to $2,500 a month, with housing, food, transportation, and comprehensive health care all included. The next country on this list takes a fundamentally different approach, and for Americans who want genuinely comprehensive coverage with zero copays at the point of care, it may be the most compelling option of the five. Now we're getting near the top of the list, and the next country is Costa Rica. Costa Rica's healthcare story is one of the most remarkable in the Americas, and it is directly relevant to American retirees in ways few people fully understand before they make the move. The National Public Health System, known as La Caja Costarricense de Seguro Social, or simply the CAJA, has been in operation since the 1940s. It runs 29 public hospitals and over 250 primary care clinics across the country. Every legal resident, temporary or permanent, is required to enroll. Once you are in, your copay for appointments, hospital visits, surgeries, and prescriptions within the public system is exactly zero, not reduced. Zero. You walk in, receive care, and walk out without a bill. The CAJA covers pre-existing conditions without any surcharge or waiting period, which is one of the most significant benefits for American retirees managing chronic conditions like diabetes, hypertension, or heart disease. You cannot be denied coverage, and you cannot be charged extra for a diagnosis you arrived with. Your monthly CAJA contribution is calculated as a percentage of the income you declared on your residency application, typically between 7 and 11%. For a retiree living on $1,000 a month in pension income, that works out to somewhere between $70 and $110 monthly. Permanent residents pay even less, as little as $45 a month per family. To put that in context, the average Medicare Part B premium in the United States currently runs over $170 a month, and that is before you add a supplement policy to cover what Medicare does not. The CAJA covers hospitalizations, surgeries, diagnostics, emergency care, and prescriptions. Costa Rica's Pensionado visa requires only $1,000 a month in proven pension income, one of the lowest bars of any retirement residency program on Earth. The average American Social Security check is nearly double that threshold. Enrollment in the CAJA is directly linked to your residency approval, which means once you receive your residency card, you register for coverage, and it begins immediately. The private healthcare sector runs alongside the KJ for those who prefer shorter wait times. At private facilities in the Central Valley, a general practitioner visit runs $60 to $75, and a specialist consultation costs about $100, still 50 to 70% below American out-of-pocket costs without insurance. Costa Rica consistently ranks as the top healthcare destination in Latin America. Costa Rica's water quality, food safety standards, and public health infrastructure are strong by regional standards and contribute to a life expectancy that has been rising steadily for decades. The country at the very top of this list is the one that took everything good about a national health system and built it into the most complete package available anywhere in the world. And the country at the very top of this list, the one that offers the most comprehensive, most accessible, and most generous healthcare access for United States retirees, is France. France's healthcare system has been ranked the best in the world by the World Health Organization, and for retirees who establish legal residency there, it is genuinely available to them. France's universal health coverage framework is called PUMA, the Universal Protection of Illness, and it covers all legal residents regardless of employment status or nationality. Enrolled individuals pay nothing for hospitalization in a public facility and receive reimbursement for 70 to 100% of general practitioner costs, specialist visits, diagnostic procedures, and approved medications. For retirees with modest incomes, the system goes further still. Individuals with annual income below approximately 12,000 euros, roughly $13,000 at current exchange rates, owe zero monthly premiums for PUMA enrollment. Think about what that means for an American on a modest Social Security income of $1,200 to $1,500 a month, living affordably in a smaller French town where rents run 500 to 800 euros a month. That person may qualify for full French healthcare coverage at literally no monthly cost. Most French residents also carry a mutual, a private supplemental plan that covers the portion of costs PUMA does not fully reimburse. Mutuelles for retirees typically run between 50 and 150 euros a month. In France, that mutuelle premium is tax deductible, lowering the effective out-of-pocket cost further. For retirees who join a collective mutuelle through certain associations, prices are negotiated at group rates and can run even lower. To access the French system, Americans need to establish legal residency. Most use France's long-stay visa or the passive income residency pathway, which requires demonstrating income sufficient to cover living costs, typically around 1,500 euros a month. France has a tax treaty with the United States that governs how American Social Security and pension income is treated locally. Most Social Security benefits are not double taxed under that treaty, but the full interaction between French and American tax obligations is nuanced enough that you will want a qualified expat tax advisor to map your specific numbers before making the move. What you walk away with, on the other side of that paperwork, is access to the healthcare system that most Americans would choose if they could choose freely. One that sends you home from the hospital without a bill, covers your prescriptions at a fraction of American pharmacy prices, and delivers care through a network of providers whose outcomes consistently rank at the very top of international comparisons. France's life expectancy for women ranks among the top 3 globally. Its cardiovascular, cancer, and chronic illness outcomes are among the strongest in the world. The system is real, it is accessible, and for American retirees willing to make the move, it is waiting. Here is what connects all 5 of these countries. They built their healthcare systems around the principle that everyone who lives there deserves coverage, not just those who can afford the premium. And for American retirees willing to establish legal residency, that principle extends to you. The average American retiree spends roughly $500 to $700 a month on healthcare costs. In each of the 5 countries on this list, that same budget buys substantially more coverage, often with 0 catastrophic cost exposure. There are real trade-offs to acknowledge. Language barriers exist outside major expat communities. Wait times in public systems can stretch for non-urgent specialist care, and your Medicare benefits stay home. They do not follow you overseas, which means extended return trips to the United States require advanced planning. The rules in each of these countries also change over time. Income thresholds adjust, enrollment procedures get updated. Always verify current requirements with the country immigration authority and a licensed expat healthcare advisor before making any decisions based on what you hear in a video. What does not change is the core reality. For United States retirees willing to make the move, some of the best healthcare in the world is already waiting. The cost of living is often lower, the coverage is often broader, and the bill at the end is often nothing at all. For perspective, a couple spending $3,000 a month on healthcare in the United States could redirect most of that spending toward travel, experiences, and savings, while receiving equivalent or superior coverage in any of these 5 countries.